light despite all of the darkness. Hi there, welcome to Soul Deep with Sheila. I am Sheila Cheptoye, and today I bring you Dr.Seggane, Musisi, who is a proprietor of Entebbe Lakeside Hospital.
Soul Deep.
Welcome, Doctor.
Thank you.
How are you doing today?
Very well, thank you.
It's so good to have you.
Very welcome.
Yes.
Yeah.
So, tell us a bit about yourself.
I'm a medical doctor by training.
Yes.
Graduated from Makerere University. And then did postgraduate outside, specialized in psychiatry. Otherwise, I was born, educated through secondary school and university in Uganda. Yes.
Okay, so you went to Makerere University?
Yes, I went to Makerere University for my medical degree.
Oh, okay. And
Yes.
then after that is when you got the scholarship?
That's, well, not really scholarship, but
Yeah.
organized the way to go abroad.
Oh, okay.
Yes, I've had scholarships before in my life,
Okay.
even in secondary school, to study abroad, but that was earlier. Yes.
Okay. And your specialty is psychiatry?
Psychiatry,
Psychiatry.
which is the study of and treatment of mental health problems.
Okay.
Yes.
All right. So today we really want to talk about bipolar from a doctor's perspective.
Yes.
And so that's why we have you, doctor, today.
Thank you.
So you can tell us about this, because it's a challenge out there.
Yes.
And I also believe that not so many people are aware how this happens or what it really is.
Right.
And so today we really want to talk more about it, in depth about
Okay.
it. Yes.
Well, bipolar
Yeah.
disorder, the full name is bipolar affective disorder.
Okay.
It's a very common illness, mental illness, affecting about 1% of the population, with equal frequency in men and women. Can start at a very young age, even as low as 10 years old or 12 years old,
Wow.
up to any age. It's called bipolar because bi means two,
Yeah.
pole. So it has two poles, a depressed pole and a manic pole. The depressed pole is when you're feeling very low in your moods. The manic pole is when you're feeling very high in your moods. It's called affective. Affective means mood. So it's really a mood disorder with two poles,
Okay.
either high or low, but sustained over a long period of time.
Okay.
And usually being quite disruptive in one's life. Yes.
So you said it can start as early as 10 years.
It can be that I've seen children as early as that. Yeah.
And
But mostly starts in adolescence and early youth.
adolescence and early youth.
Yes.
Okay. So what are some of the signs that you can tell for a 10-year-old or a teenager?
In children, you usually see actually disrupted sleep,
Okay.
a tendency to talk continuously all the time, to be argumentative, quarrelsome, sometimes threateningly, sometimes aggressive, but most times just happy mood, too happy, euphoric, and with no bounds. We use the term expansive mood, or sometimes infectious mood. They make you laugh.
Yeah, yeah.
But it can also be irritable and angry. Yes.
So what you're saying is it's actually possible to think that this child is normal, yet there is something.
Yes, I was going to add on that that's the manic part.
Okay.
The depressed part is that they feel low in mood, very sad, isolative, will not sleep well, have no energy, no interest in things, and sometimes in the extreme even feeling that life is not worth living and even attempting suicide.
At such an early age.
It has happened, children do attempt suicide. But those are the main symptoms of
Yeah.
bipolar,
Yeah.
even in adults.
Based on the signs you're giving, the manic,
Yes.
it's actually possible to imagine that this child
Yes,
is
yes.
just a happy child.
Or a
you know?
spoiled child.
Or a spoiled child.
delinquent child. And
exactly.
many parents begin by trying to punish the children.
That's right.
But eventually they realize that it is beyond their control. Yes.
But is it also possible, because I think when a parent punishes the child, and they think this child is getting out of control, is it possible for some of these parents not to actually realize that this might be something?
Very much so, including teachers. But like I said, although it can start that early, it's really a disorder which starts mainly in adolescence and early youth. That's where most of the bulk is.
Okay.
But if you talk, say, in secondary school, these kids will be seen as being antisocial and antagonistic to authority and argumentative.
Yeah.
Sometimes they take on what we call grandiose delusions. They feel that they have the ability to change the world, maybe through prayer or through money or other things. But mainly, it's a disorder of mood.
It's a disorder of mood.
Yes.
Okay. What is the cause of this mood, the sudden change in mood? And yeah.
Actually, some people call it mood swings.
Yeah.
I don't want to use the word mood swings, because it is really a sustained presence of a mood at one of the two ends.
Yeah.
Causes vary. Usually, when we talk in mental health, we say causes can be biological, like genetic or inherited. They can be caused by changes in the body, metabolic changes in the body, or brought in by other diseases, including things like HIV. But it can also be caused by substances that people take, abuse drugs. These common substances, marijuana, mairungis, cocaine, stuff like that. But can also be brought on by other illnesses of the brain, like certain cancers of the brain. These are rare causes. The most common cause is really a familial pattern, or just coming out of the blue. And it causes a chemical disturbance in the brain.
Okay.
Yes.
So the one that you mentioned about genetic,
Yes.
yeah, the genetic disorder. So if you had a parent that had bipolar and probably they had no idea,
Yes.
you can actually inherit it. Is that what you're saying?
Yeah. Usually in medicine we talk in terms of vulnerabilities, that you're vulnerable to getting it. For example, in the general population I said it's about 1%. But if you have a first degree relative who has it, either a sibling or a parent, there's a 10% chance. And if it's an identical twin, it goes up to about 70%, 40 to 70% likelihood of getting it.
Wow.
If both parents have it, then you are also in the 40% likelihood of getting it. So we say that there's a tendency for it to be running in biological relatives.
Wow. I'm also interested in knowing how does a parent who has bipolar raise their children?
The good thing about bipolar disorder is that it has episodes.
Okay.
So you can have an episode which can last anywhere between 2 days to weeks to months. And it may go away for a year or 2 or even 10 years. Or it can be recurrent. Every 2 years it occurs. And it can either be a manic episode or it can be a depressed episode. But many times people have one episode and goes away and doesn't come back until after a very long time. In ladies, it may happen after birth, for example.
Yes.
And then it may go away. Never happen again, or it may come back in the next delivery, or it may disappear. So this episodic nature allows time when it has gone for one to lead a very normal life.
I see.
But the time when it comes, it becomes very disruptive. And if you're a young person, say going to university or secondary school, it can disrupt your studies. Or if you're a married lady or a married man, it can disturb your relationship, your marriage. It can disturb your child care, certainly. And of course your employment, you'll be fired from your job. So it becomes very important to control it so that you can go on with your life undisturbed.
And that actually takes me into our employment space. Somebody that has bipolar, is it easily recognized, or do you actually have to let people know that, okay, this is what I have?
It will be recognized by its symptoms.
It will be
It's
recognized.
disruptive.
It's disruptive.
People come overdressed, singing, loud, obnoxious, not knowing space, between themselves and others, sometimes disrespectful or appearing to be disrespectful. And with this grandiosity, which may be in the form of religion, say for example, just one example, they may feel that, they ought to pray for you or convert you or do all kinds of things to you. Sometimes you find them on the street, praying, preaching their way,
I see.
wanting to convert the world because they feel they have a special mission given to them by God. They feel they're very powerful, That's what we call grandiosity.
I see.
Yes.
Wow.
So usually they tend to lose jobs. Yes. Because work will not tolerate that.
Yeah.
Yes.
Okay. What about in areas of relationships?
Very disruptive. There's a tendency, especially in the manic phase, for people to want enjoyment all the time. And they'll have affairs they'll regret later in life, or very disinhibited libido. And that will cause a problem in relationships. Sometimes even to the point of contracting diseases and stuff like that. So that's why I said bipolar can be very disruptive in one's life. Now in the depressed phase, it's the other way around. They would not like to engage in any relationships, libido goes down, sexual activity goes down, and even total loss of interest and total neglect of the spouse or even their everyday work. In extreme cases of depression, they may even want to kill themselves, and they will attempt suicide, sometimes successfully.
Wow.
So it's a serious disease. It's one of the severe mental illnesses that we have.
Okay.
But fortunately for us, not so difficult to treat. Problem though is that they tend not to want to accept treatment,
Okay.
especially as they're going up, because they're enjoying themselves. It's a high mood.
I see.
They feel great. They feel wonderful.
So they don't want to lose that feeling at all?
No, they don't want to lose it, and they will not accept that they have an illness.
How is that for you on the other side now? As a doctor, how are you able to...
That's where the problems begin,
Yeah.
to convince them that this is an illness for which you need treatment and that can be controlled. And even then, to stay on medication, maintenance medication to prevent a relapse becomes difficult for people. But that's true of chronic diseases, of long-stay diseases, be it high blood pressure, be it diabetes. People have a hard time taking medications all the time throughout their lives.
Sure. And talking about medication, does everybody have to take medication, or is there a way that you
Very
can...
good question.
Yeah.
Minor degrees you may not have to, but usually it has a tendency to keep increasing and increasing and becoming disruptive. People who take medication eventually lead a much better life than those who don't. Those who do not take medication go through ups and downs in their lives and a tendency to downward shift in social class, in the economy, because they will not sustain jobs. And sometimes they can do things that will be very destructive. For example, they can spend all their money, and end up very poor. People who are very rich. I've seen somebody spend up to $1 million, on a party, which they would not do normally.
Yes.
Yes.
And in that instance, does the person feel like that's a normal thing to do, or they just feel some excitement or some...
They feel excitement. The person with bipolar disorder may not know that they're having an illness at that time, especially if they've never had it, if it's occurring for the first time. Those who have had it for a long time will know that they're in an episode. They may refuse treatment or they may accept treatment. Yes. But usually after we have given them counseling and therapy, they recognize the symptoms and they will agree to have treatment. Relatives may not sometimes may not know that they have an illness. We also have a tendency to attribute mental illness to so many other causes, including witchcraft, including religious curses, demons, magini, things like that, which are all not true. And usually when such beliefs come in, they will not usually go for treatment. And people thinking that mental illness is always treated by traditional healers or traditional medications or things in clans and stuff like that. These ones usually disrupt treatment. But there is sometimes room for traditional healers, because they give good counseling, if they don't go too much into the supernaturals.